Hello guys, how are you? I hope so that you will be fine and enjoying good health. Today I have selected a topic on methods of contraception. As you know, there are different methods of contraception including long-acting reversible contraception, the implant or intrauterine device IUD. Then second one is the hormonal contraception, the pill or the Depo-Provera injections. Number third is the barrier methods or by using condoms, and fourth one is the emergency contraception, and the fifth one fertility awareness, and sixth one is the permanent contraception, vasectomy and tubal ligation. So first of all we will discuss long acting contraception, LARC, which lasts for a long time. There are two types of long acting reversible contraception: the intrauterine device, which lasts for 3 years, 5 or 10 years, and then is the implants. First of all we will discuss about the intrauterine device, IUD. The intrauterine device is a type of contraception. It's a small device that is placed inside your uterus womb to prevent pregnancy. It is more than 99% effective at preventing pregnancy. It works for 3, 5 or 10 years depending on the type of IUD, and you don't need to do anything after it's put in is inserted. It's fit or forget contraception. It is reversible. You can choose to have it taken out at any time. After that, you will be able to get pregnant. IUDs do not protect you from sexually transmissible infection, STIs. The best way to reduce the risk of STI is to use barrier protection such as condoms with all new sexual partners. So what is an IUD? An IUD is a long-acting reversible contraception, or LARC. It's a small device that is placed inside your uterus womb to prevent pregnancy. It can work for up to 10 years. Depending on the IUD type, it can be easily removed sooner if needed. There are two types of IUDs, one with the hormones and one without hormones. Copper IUDs contains copper, a type of metal. It doesn't contain hormones. And hormonal IUDs contain the hormone progesterone or Mirena or Jadis. How does it work? The hormones or the copper stop the sperms reaching the egg. Sometimes the sperm does reach the egg fertilization, so the IUDs stop the egg from attaching to the wall of the uterus. Then getting an IUD for emergency contraception. The copper IUD can also be used as an emergency contraception. It can be inserted up to 120 hours, 5 days after unprotected sex, or within 5 days of your earliest expected date of ovulation. If you have had unprotected sex since your last period and you want an IUD, contact your healthcare provider with an emergency copper IUD. And getting an IUD for a heavy or painful periods. For the hormonal IUD, Mirena can help with the heavy or painful periods. Most people with Mirena will have light bleeding or no periods at all. If you want a hormonal IUD to help you to manage your bleeding, the nurse or doctor may recommend the heavy bleeding. It is investigated before your IUD is put in. And if you have heavy or painful periods, you should not get a copper IUD because it might make them worse. What are the advantages of an IUD? It is a 99% effective in preventing pregnancy. Only 1 in 100 people will get pregnant each year. And long acting, it lasts for between 3 and 10 years depending on the type of IUD, and reversible. You can choose to have it taken out at any time, and after that you will be able to get pregnant, and you do not need to think about contraception every day. Does not affect the breastfeeding, does not get in the way of sex, and the copper IUD does not contain any hormones. The copper IUD can also be used as an emergency contraception, and the hormonal IUD has a very small amount of hormones, and most people have no side effects from this. And the Mirena IUD with hormones can help with period bleeding and pain, and most people with the Mirena will have light bleeding or no periods at all. Studies show that IUDs do not cause pimples, headaches, sores, breast, or nausea, mood changes, loss of sex drive, or weight gain. There is no evidence of extra risk of cancers. And you need to use condoms and lubricant to protect yourself from sexually transmitted infection. If there is a chance you may have a STI, have a checkup before you get an IUD put in. How do you get an IUD? You must make an appointment at the family planning unit, and if you are not sure about whether an IUD is right for you, you may want to book an appointment before the IUD is put in to talk about your options. An IUD may be put in at any time you choose, as long as you are not pregnant or at risk of being pregnant. Some good times to get it put in: while you have your period or just after 4 weeks after your baby is born or at the time of the surgical abortion as emergency contraception up to 5 days after unprotected sex. Copper IODs may be used. If you have an infection, you should get it treated before you get an IOD put in. Usually, the IOD can be put in at your first appointment, but sometimes it is not possible, and this could be because you cannot be reasonably sure you are not pregnant, or you have not had a period since taking emergency contraception (ECP). You have heavy bleeding, which needs to be checked out, and it is difficult to insert the IUD. Then these are the cases in which it is not possible to put in place your IUDs. So in this case, for you, your nurse or doctor will talk to you about what happens next. Usually, another IUD appointment will be made for you to have the IUD put in. So this was about the IUD. Then we will come to the implants, which last for 5 years. The implant, also known as the rods, are a type of long-acting reversible contraception (LARC) and more than 99% effective. They work up to 5 years and fit and forget. You don't need to do anything once it has been put in. Your bleeding may change. It is not annoying. There are pills to help, and you can choose when to have it taken out. So, make an appointment at the family planning. Tell the receptionist, tell the doctor about the that you want the contraceptive implant, the rods, or that's what you want. For a woman, the medication they are taking means the implant may not be right for them. So the implant is made up of two small rods the size of a matchsticks. The rods are put under the skin in the side of your arm, and they slowly release a hormone called progestogens, and they work for up to 5 years. And you can have them taken out whenever you want. And how does it work? Implants can stop your body from releasing an egg each month, and they also thicken the mucus in your cervix so sperm cannot get to an egg. So how will does it work? The implant is more than 99% effective in preventing pregnancy. And this means for every 1,000 people using an implant, only a few will get pregnant each year. You will be able to feel the implant under your skin, and your periods might change. You might bleed even often or not often at all, or have light but persistent bleeding, or you could have a normal period or no period at all. This is all safe for your body, and if your bleeding becomes a problem, there are pills you can take that will help you. And can I get pregnant after the implant is taken out? Yeah, you will be able to get pregnant as soon as possible as the implant is taken out. Pregnancy is very rare with implant. If you do get pregnant and want to continue with your pregnancy, you will need to have the implant taken out. There is no extra risk for your baby. What are the advantages? Long acting, it lasts for up to 5 years. And reversible, you can choose to have it taken out at any time. After that, you will be able to get pregnant again. 99% effective, it works very well, and you don't need to think about contraception every day. So study shows that the implant do not cause any change in your weight, mood, sex drive, or give you headaches. What are the disadvantages? You might have irregular periods or periods that last longer. This is quite common in the first 6 months, but it can last as long as you use the implant. This can be annoying, but it is not harmful, and the implant will still work. If the bleeding is a problem, you can get pill to help. You might have a sore or bruised arm after the implant is put in or taken out. There is a small risk of infection. Sometimes it's not easy for the nurse or doctor to find the implant, and you might have to see someone else to take it out. And who can get an implant? Almost anyone at any age can have an implant if it is good. If you forget pills, appointment for injection, or if you have a medical reason that stops you using the combined pill. If you have had breast cancer or you are taking some medication, you should not get the contraceptive implant. Tell the nurse or doctor that if you are taking regular medications, do know you need to use condoms and lubricants to protect yourself from sexually transmissible infections. If there is a chance you may have an STI, have a checkup because it will not protect you from STIs. How is the implant put in and taken out? You need to see someone who is trained to put in and take out the implant, like a family planning nurse or a doctor. An injection is used to numb part of your arm so you don't feel anything when the implant is put in under the anesthesia. And the local anesthesia, the rods are put under the skin and special plasters are used to hold the skin together until the skin heals. and the implant is taken out in the same way, it will leave a small scar. So now we would come to, once you have an LARC put in, you don't need to remember to take contraception every day or every month. LARCs, long acting reversible contraceptives, are the most effective types of contraception, and they are more than 99% effective at preventing pregnancy. These contraceptives use hormones to prevent pregnancy, and hormonal contraceptives include the pill and the Depo-Provera injection, and there are two types of pill. One is combined oral contraceptive pill, and another one is progesterone only contraceptive pill. You take one pill each day. If you take the pill correctly, it is more than 99% effective at preventing pregnancy. The Depo-Provera injection is an injection you will get at every 3 months. If you get your injection on time, Depo-Provera is more than 99% effective. Combined oral contraceptive pill is a type of contraception. It is a pill you take every day to stop getting pregnant. The combined pill contains two hormones, estrogen and progesterone. This pill is different from the progesterone only pill. Estrogen and progesterone stops eggs developing, so no egg is released from the ovary. How well does it work? The pill is normally 92% effective. This means 8 in 100 people taking the pill will get pregnant each year, and it can be 99% effective if it's taken correctly and continuously. Taking the pill continuously is when you take all the hormone pills from one packet, then start the hormone pills from a new packet, and this means missing the non hormone pills and skipping your period. This is the most effective way to take the pill. When do I take it? It is the best to take this pill at the same time every day. You could set the alarm on your phone to remind you. If you miss taking one hormone pill, it's still okay. There are three different ways to take the pill, and the family planning nurse will explain you how to choose what's right time for you. Have a period each month. Take the hormone pills and then the seven non-hormone pills. You will get your period while you are taking the seven non-hormone pills. It may be lighter and less crampy than your regular period, and you will not be protected from pregnancy if you forget two or more pills in a week. Have a period every few months. Miss the seven non hormone pills most months and take the hormone pills continuously every day. Take the seven non hormone pills when you want to have a period. No period option. Take the hormone pills continuously every day. Take the hormone pills from one packet and then start the hormone pills from a new packet, missing the seven non hormone pills. This means you would not get your period. With this option, you are protected from pregnancy unless you forget more than 8 pills in a row. You can do this for as many packets of hormone pills as you like, and you can take the non hormone pills to have a period when you want to. You might notice bleeding and spotting at first, but this usually goes away with time, or you can take up to 7 non hormone pills to have a period. So, this if you have just started taking the pill, you might find that you feel sick, especially if the pill is taken on an empty stomach, or you have a sore breast, or you have unexpected vaginal bleeding. These usually get better with the time. But if you are worried about any changes, we recommend that you keep taking the pill and call your doctor. Your period may be lighter than usual, but if you miss your period, keep taking the pill as the doctor advises you. If you can use it, if you are healthy and do not smoke, you can keep taking the pill safely for many years. You should not use the pill if you have had a heart attack, stroke, or blood clot in your legs or lungs, or a family member has had a blood clot in their legs or lungs, or if you are over 35 or smoke, and if you are overweight, if you are having migraines or very bad headaches, or if you use them sometimes for medications or herbal remedies. The doctor will talk to you about this. And if you have your leg in plaster, or you use a wheelchair, or you are bedbound, so don't take it. Yes, you will be able to get pregnant as soon as you stop taking the pill. If you do get pregnant while taking the pill and want to continue with your pregnancy, there will be no extra risk for your baby. What are the advantages? Up to 99% effective, easy to use, does not get in the way of sex. You can choose to have lighter, less crampy periods or no period at all. As soon as you stop taking the pill, you can get pregnant. It reduces your risk of ovarian and endometrial lining of the uterus cancer by 50%. Some pills can help with pimples and acne. The research does not show a link between the pill and the weight gain, headaches, breast tenderness, nausea, or change in sex drive. What are the disadvantages? If you have to take it every day, even if you don't have sex that day, you have to take it. You might have irregular bleeding in the first month or two, or the bleeding continues. Keep taking your pills, but make an appointment to see a doctor or a nurse. You might get dark patches on your face, which is called sclerosis. Are there any other side effects? Serious side effects are rare. If you take the pill and you smoke, you will be more at risk of a stroke or heart attack. If you don't smoke, you are unlikely to have these problems. Some pills can increase the risk of blood clots in the leg from 2 in 10,000 people per year to 6 times that rate. It is very important that if you notice any of these symptoms, you should get help from a doctor, a family planning doctor straight away, because it could be a sign of a serious problem. Get sudden chest pain, or you cough up blood, or find it hard to breathe, or have pain in the lower legs, or have had very bad headaches. And some short term risk factors when using the pill are plane flights, high altitude, surgery, temporary immobility, being not able to walk or move because of some surgery, the pill and the cancer. Breast cancer. Research shows that even if there is a risk of breast cancer, it is small. Before you start taking the pill, the nurse or doctor will ask you if you or your any family member has had breast cancer. Then cervical cancer. If you have been on the pill for 5 or more years and you carry certain types of what virus, you might be more at risk of cervical cancer, whether you take the pill or not. You should get a cervical smear every 3 years. People can get the subsidized HPV vaccine to prevent cervical cancer up to 26 years old. Then ovarian cancer. Your risk for ovarian cancer lowers by 50% if you take the pill. Even 30 years after stopping the pill, you still have a lower risk. Then endometrial cancer. This is cancer of the lining of the uterus, and your risk of endometrial cancer lowers by 50% if you take the pill. Even 15 years after stopping the pill, you will still have a lower risk. Does this pill protect you from STIs? No, you need to use condoms and lubricant to protect yourself from sexually transmissible infections. If there is a chance you may have an STI, have a checkup. So now there is progesterone only contraceptive. What is the progesterone only pill? The progesterone only pill is a pill taken to prevent pregnancy. The progesterone only pill contains the one hormone progesterone. It does not contain any estrogen. How does it work? Progesterone only pill works mainly by thickening the mucus in the cervix so sperm cannot travel through it. They also change the lining of the uterus so it is less likely to accept a fertilized egg. And Cerazette also works by stopping the production of a monthly egg. How well does it work? Typically, the progesterone only pill is 92% effective, which means a pregnancy rate of 8 people per 100 each year. And when pills taken perfectly, meaning no pills are missed, it can be more than 99% effective in preventing pregnancy. When do I take it in? Some progesterone only pills must be taken within 3 hours of same time every day, and Cerazette must be taken within 12 hours of the same time every day. What will I notice? Your bleeding pattern may change. You may have regular periods, irregular, or more frequent episodes of bleeding, or no bleeding at all. Will I still be able to become pregnant after I stop taking the progesterone only pill? There will arise a question. Your natural fertility will return as soon as you stop taking the progesterone only pill. If you get pregnant while taking the pill and decide to continue with your pregnancy, the chance of having an abnormal baby is not increased. How can use it, or who can use it? This pill is especially recommended if you are breastfeeding and if you cannot use the combined oral contraceptive pill for medical reasons. Who should not use it? This pill is not recommended if you have had breast cancer, or if you are taking some medications, over the counter preparations, or herbal remedies. Check with your nurse or doctor if you are take regular medicines. What are the advantages? Easy to use, it is simple and convenient, does not interfere with your sexual intercourse, does not affect the breastfeeding, can be used by people of any age, and there are few side effects. Research does not show that the progesterone only pill causes weight gain, depression, or headaches. What are the disadvantages? The pill must be taken every day, whether you have sexual intercourse on that day or not. Some progesterone only pills need to be taken at the same time every day, and this pill may change your period. You may have some irregular bleeding for a few months after starting the pill, and this does not mean the pill is less effective as long as you have had no not missed pills. If the bleeding continues, keep taking your pill, but check with a nurse or a doctor at or at one of your clinic. And does this pill protect you from sexually transmitted infection? No, you need to use the condoms and lubricant as well to protect against the STIs. And the research shows no link between the progesterone only pill and the cancer. So then we have Depo-Provera injection, and this is given every 3 months interval. Depo-Provera is a contraceptive injection containing progesterone, and some people call it the injection, the jab, or DP. Progesterone is similar to one of the hormone produced naturally in the ovaries, and the injection is given every 13 weeks. How does it work? Depo-Provera prevents pregnancy by stopping the ovaries releasing an egg each month, and there are also changes to the lining of the uterus endometrium. How well does it work? Typically, Depo-Provera is 97% effective. This means that 3 out of 100 people using Depo-Provera will get pregnant each year. If you have your injection on time every 13 weeks, it can be more than 99% effective. What will I notice? Your bleeding may be irregular or longer than usual, especially in the first 3 to 6 months. This is safe for your body, and there are pills to stop this if it happens. About 70% of the people will have no periods after 4 injections. This is safe. Can I still become pregnant after stopping the injection? Your natural fertility can take some time to return to normal. On average, this will be 6 months, but it can take up to 1 year. If you are planning a pregnancy soon, it may be best not to use Depo-Provera. If you get pregnant while using Depo-Provera and decide to continue with your pregnancy, there is no additional risk of damage to the baby. Who can use it? Most people can use Depo-Provera, even those who cannot use a combined contraceptive pill. Who should not use it? If you have had breast cancer, you should not use Depo-Provera. If you are planning a pregnancy in the next few months, you may prefer to use a different type of contraceptive. What are the advantages? Almost 100% effective, convenient, it lasts for up to 6, its effect lasts for up to 13 weeks, and no daily pill taking, and doesn't interfere with sexual intercourse. No one else needs to know you are using it. Reduces the risk of endometrial cancer, cancer of the lining of the uterus by 80%, as if you have heavy or painful periods. What are the disadvantages? Once you have had injection Depo-Provera, it lasts at least 13 weeks, which can be a nuisance for if you experience a side effect, and it can cause irregular, longer than usual bleeding. This is more common when first starting to use Depo-Provera and often improves with time. There are many possible side effects which include changes in the mood, libido, or headaches. Allergic reactions are possible, but this is extremely rare. And weight changes, some people put on weight, some lose weight, most do not change any weight. And bone density, Depo-Provera has been associated with the reduction in bone density. This improves after stopping Depo-Provera. And the cancer, about cancer, the risk of endometrial cancer is reduced by 80%. There is no overall change in the rate of cancer of the cervix, the ovary, or the breast cancer. And does the injection protect you from sexually transmissible infections? No. You need to use the condoms and lubricant as well to protect against STIs. So now we will come to what are the barrier methods. Barrier method is stop sperm from entering the vagina. The two barrier methods are, number one is condom and number two is internal condoms. Condoms protect against sexually transmissible infection, STIs, and from unintended pregnancy. You can buy internal condom from your pharmacy, and you can get prescription for condom from family planning unit, or you can buy or purchase them from pharmacies, supermarkets, and other shops. What is the emergency contraception? There are two options of emergency contraception: the emergency contraceptive pill, ECP, or a copper IUD. ECP can be taken up to 3 days after unprotected sex. If you are an average weight, the ECP is 98% effective. If you weigh more than 70 kg, the ECP is less effective, and a copper IUD is recommended. If you weigh more than 70 kg and you choose to take ECP, You should ask if taking a double dose is the right option for you. The copper IUD can be inserted up to 5 days after unprotected sex and is more than 99% effective at preventing pregnancy. Emergency contraception can be used to prevent a pregnancy if you have not used protection. Your normal contraception, for example, condom splits. If you have missed more than one contraceptive pill, if you have been vomiting or had diarrhea while on the pill, if you have missed your injection, if you have been forced to have sex without contraception, it is not good idea to use ECP as your regular method of contraception. It is less effective than if you were using LARC or hormonal method. What is condom? Condom is a fine tube which is rolled on to the penis before sex. It is a barrier to stop sperm and infection passing between sexual partners. It is usually made of rubber. Condoms are used for vaginal, anal, and oral sex. And why use condoms? Condoms help protect against pregnancy and sexually transmissible infections, including HIV, which can lead to AIDS. Partners share responsibility for safer sex and contraception. Most other methods of contraception do not protect you against STIs, including HIV. To protect yourself, use condoms as well. Condoms are easy to get, are easy to use, have no side effects unless you are allergic to rubber, and help prevent cancer of cervix. Then there is internal condoms, which are another type of condoms. Internal condom is used during intercourse to prevent pregnancy. It also reduces the risk of sexually transmitted infections. It is a tube with flexible rings at each end. One end is closed and the other is open. The internal condom is inserted deep into the vagina just before vaginal intercourse. The ring at the closed end holds the pouch in the vagina, and the ring at the open end stays out the vaginal opening during intercourse. How do internal condoms work? Internal condoms covers the inside of the vagina and protect and collect pre-cum and semen during ejaculation. This keeps sperms from entering the vagina. The internal condom is made up of nitrile polymer, and that's the same material that medical gloves are made from, and they are latex free, so can be used by people who are allergic to latex, and can be used with oil based and water based lubricants. The internal condom is more effective when it is used correctly every time. Like all contraceptive methods, we typically use the pregnancy rate is 21 out of 100 each year, and if the internal condom is always used correctly, the pregnancy rate drops to 5 per 100. And almost everyone can use internal condom safely. They can be used by just about anyone who can use a tampon. They are also safe to use during sexual activity, and internal condoms can be purchased from pharmacies, and they are available also from other shops as well, healthcare shops. So it was about the condom and internal condoms, and now I will come to the vasectomy or the tubal ligation. Vasectomy, when you ejaculate, come the fluid or semen from your penis contain sperms. Sperms are made in your testicle balls or your testicles, which are oval in shape, and travel up your vas deferens tubes to mix with your semen. These are the tubes that are cut and tied when you have a vasectomy. After vasectomy, there are no sperms in your semen. Your testicles still make sperms, but that they are absorbed by your body. There is where it is done. A vasectomy is a simple operation. It can be done at a doctor's surgery or a hospital, and the doctor or a vasectomy counselor will explain the operation and answer the question you or your partner may have. If you decide to go ahead, have an appointment, and then they will make the operation for you. In no scalpel vasectomy, the doctor feeds the tubes under the skin and hold them in place with a small clamp. The doctor makes one tiny puncture with a special instrument. The same instrument is used to gently stretch the opening so the tubes can be reached. The tube is brought to the surface through the small opening. Different doctors use different techniques, but all are designed to ensure the two ends of the cut tubes remain separate. The second tube is treated in the same way through the same hole, and there is very little bleeding with this technique. No stitches are needed to close the opening, which heals quickly without leaving a scar. You can expect some soreness and bruising for a few days. Plan to stay home and rest. Ask the doctor about pain relief. You can probably return to light work after 2 days. Avoid heavy lifting exercise or sexual intercourse for 7 to 10 days, and you can have sex after 2 to 3 days if it is comfortable. But remember, you will still need contraception. If you are having penis and vagina sex, your partner will not be protected from pregnancy until semen samples are sperm free. Your doctor will arrange the test. They are done 3 months or 16 ejaculations, whichever comes first after the vasectomy. Until then, you will need to use another method of contraception. Can it affect my sexuality? After vasectomy, you will still have erections and orgasm. You ejaculate about the same amount of semen, but it is no longer contains sperms. Your hormones do not change. Your sex drive and ability to have a sex do not change. The only change is that you cannot be a father of a child. If you consider your decision carefully and do not feel pressured by anyone, you are unlikely to regret your choice. Vasectomy is a very effective method of contraception, and overall 1 in 300 may fail. After you have had negative sperm count, the chance of failure drops to 1 in 2000. It is not always possible to reverse a vasectomy. Many factors can affect the success rate of a reversal. On average, 50% of reversals result in a pregnancy. Sometimes the person can develop antibodies to their own sperms after a vasectomy, and this may make pregnancy after reversal less likely. A second option after vasectomy is direct retrieval of sperm from the testicles and in vitro fertilization to achieve pregnancy. Another option is to freeze some of your sperm so they can be used later. So, if this is something you would like to consider, talk it with your doctor, vasectomy counselor before your operation. An infection is uncommon, it is usually serious. Internal bleeding may cause swelling and pain, and a painful lump may form in the scrotum where the operation was done. The pain usually disappears in a few weeks. Intermittent long term scrotal pain is possible but very rare, and research shows no association between vasectomy, heart disease, or cancer of the testicles or prostate. It is recommended that you discuss sterilization fully with your partner because you are both affected by the decision. However, it is not a legal requirement for your partner to give consent. You can choose a vasectomy if you have no partner, if you have no children. So this was about vasectomy, which is being performed on the male subject, and then we have tubal ligation. Tubal ligation is also known as having your tubes tied. Is a procedure to close both fallopian tubes, which means the sperms cannot get to egg to fertilize it. How a tubal ligation is done? The tubes are closed using rings or clips or by cutting and tying. It is usually done by putting a tiny telescope called a laparoscope in thorough a small cut near the belly button and close the tubes to throw another small cut near the pubic hair. If a laparoscope cannot be used, then a longer cut is made near the pubic hair, and tubal ligations are done in the hospital under general anesthetics. Depending on the type of operation, it may be day surgery or may require a stay 1 or 2 days in a hospital. The failure rate for tubal ligation is 1 in 200. And does family planning do tubal ligation? We don't do tubal ligations, but at our clinics, only the nurses and doctors can offer to you at the hospital, and to a specialist who is a reproductive specialist who can perform the procedure. And talk to your doctor about the tubal ligation. That might be an option for you. It is not always possible to reverse tubal ligation, and the reversal procedure is not available in public hospitals. If you consider your decision carefully and do not feel pressured by anyone, you are unlikely to regret your choice. It is recommended that you discuss sterilization fully with your partner. This is because you are both affected by the decision. However, it is not a legal requirement for your partner to give consent. You can choose a tubal ligation if you have no partner, or if you have no children, or if you have no planning for your children in future. So it has to be taken by the female and male by both sides. So this was all about family planning, and I hope so that this video would be very effective for you, and you would have listened this video very carefully. And I hope so that you will share this video with other individuals as well. And if you have liked this video, then And don't forget to subscribe my channel, and thank you for listening this video. Have a wonderful nice day. Thank you very much.